This morning on The Real Story, pressure mounting on Governor Lamont. With COVID cases rising, will restrictions come back? Will vaccines be mandated? What role will the legislature play in these decisions? This morning, two members of the Public Health Committee give us their take. State Senator and Dr. Saud Anwar and State Senator Heather Summers are our guests. Plus, is Connecticut in a full-blown jobs crisis? Columnist Red Janke says that we are, and he believes the problem is way bigger than we realize, and he says it isn't even being talked about. The numbers he says we're missing and what it could mean for our economic recovery. It's all today on The Real Story. Good morning, and thanks for joining us on The Real Story. I'm Jen Bernstein. Well, the COVID metrics haven't reversed course since our show last week, unfortunately, and they do continue to tick up, which brings along a lot of questions on how our state will react. And if you're the governor of Connecticut, you've got a lot of people asking you what we're going to do. With the CDC recommending mask wearing indoors for those even vaccinated, will Connecticut reinstate the rule with a mandate? Will he require the vaccination for state employees? Could we see a travel restriction put in place again? Will schools be required to mask up in the fall? So many questions, and the governor so far has said that these aren't easy answers. He's essentially mulling things over, but he has said there are certain matters that he wants to get lawmakers' input on, especially with his extended powers ending 1 month from now. So, what do lawmakers think? Let's bring in two members of the Public Health Committee, State Senator from South Windsor, Dr. Saud Anwar, and State Senator Heather Summers from Groton. Thank you both so much for being here this morning.
Thank you, Jen, for having us.
All right, so this is a little bit of a different situation than we were, a really big different situation than we were in a year ago. But we have the governor who might have to make some decisions here. The legislature, though, stands ready to act. So, Dr. Saud Anwar, what role do you all think you're going to play, and have there been any discussions with the governor yet on some of these decisions he's going to have to make?
Well, Jen, thank you for having me. I just want to share that right now things have been changing so rapidly. Every day is something new that's happening, and we're getting more and more data and information. So I know that the governor's team is watching the numbers very carefully. So is anyone who is concerned about the community and the community as well. So we will be in the position to have to make some decisions in the coming days and weeks.
Senator Summers, you know, we hear so many of these really big decisions that the governor is mulling over right now. What's your reaction when you're hearing that he might have to make some of them unilaterally, but that he wants to bring in the legislature? What are you hoping to see?
Well, thank you, Jen, for having us this morning. I think it's interesting because the governor has come to the legislature asking for total executive authority and control and power. Those powers end on September 30th, but there's no guarantee that he won't ask for an extension. So for me, asking the legislature to weigh in is nice. However, I fully believe that the legislature should be in right now helping craft and make those decisions. Right now, we are under total control and authority by the governor's office and the governor himself. So he has some tough calls to make. You know, you can't just ask the legislature to come in when those decisions become very difficult. He has total power, so he has the accountability until September.
All right, so you think the state's really not doing enough, using you all enough at this point. Dr. Saud Anwar, are we where we need to be at this point, especially with the Delta variant ramping up?
I'm really worried, Jen, because this Delta variant has the capacity to spread like wildfire. And we have seen the patterns where the unvaccinated in our community, they are the ones who are getting infected very much but also the ones who are vaccinated, it's also impacting them as well. So there are some breakthrough cases, but overwhelming majority are the ones who are unvaccinated, and they're getting really sick. So we are going to start to see an increase in the number of hospitalizations and critically ill individuals. So I'm really worried about our state at this point.
Do you think that state employees should be mandated to be vaccinated or tested, weekly?
I can share with you, I believe, the ones who are interacting with the individuals who are immunocompromised, the ones who are in healthcare facilities, the ones who are in close contact with vulnerable populations, my idea and my understanding is absolutely yes, because we have done this for flu vaccine all along. But we have a variant which is very rapidly spreading. And then for those individuals who can put others at risk, yes.
Senator Summers, your opinion on that?
My opinion on that, first of all, is I think some of the messaging has been a little bit distorted by the media. I believe that both the president and the governor have indicated that if a state employee and or in our hospital systems, if you don't take the vaccine, that you're going to be required to have weekly testing, whether it's twice a week or once a week, and wear special PPE, et cetera. So I think that's a lot different than, quote, mandating that state employees get a COVID vaccine. That being said, I agree with Senator Anwar that this Delta variant is much more easily transmittable and catching. And the best thing that we can do in the state of Connecticut, all of us, is to encourage those who have not gotten vaccinated to get vaccinated. And I think one thing that would go very far is if our federal FDA would complete the studies and have a full approval on these vaccines. That would give people the comfort level they need who are hesitant to go ahead and get vaccinated. Another thing I think the state of Connecticut could do through DPH is to review all of the cases here in the state of Connecticut. How many people have been vaccinated? Has there been any adverse reactions, which we know that there have been some, but correlate that data and have that data be transparent for those who are possibly hesitant in taking the vaccine. I think that would make people feel much more confident and comfortable taking the COVID vaccine. And it is clear that the clinicians I have spoken to, even as early as a few hours ago, the people that are getting sick from this variant are the younger folks, the 18 to 30-year-olds. And we do have people that are vaccinated, but not enough. We're in the 60% range, and we really need to encourage those who have not gotten vaccinated to become vaccinated.
Let's talk about school this fall. I mean, it's, at this point, a month away for a lot of school districts having to make some of these decisions. Dr. Anwar, do you think that teachers and kids should be masked up in the fall?
Absolutely. This is very clearly seen by CDC. They have actually recommended in very clear terms that this should be happening. The American Association of Pediatrics is very clear about this as well. Look, our children are not vaccinated beyond a certain age because we don't have vaccines approved at this time for younger than 12. So that's a big group. And there are children who also cannot be vaccinated because of health-related issues. And there are children who are living with parents and grandparents who may not have the immunity that they need to be protected. So we have a responsibility to make sure that our schools are a safe place and not a place for spread of illness, especially a variant that is actually able to expand and spread at a multi-fold level than what we have seen in the past. Yes, we have to have it.
Senator Summers, your opinion on that?
I think that we have to wait and see exactly what the data shows. Again, if that is the decision that is going to be made, that needs to be made very soon with collaboration with our school districts and our local public health districts. And that's something that the governor is going to have to decide because, again, he is under total executive authority, and his executive authority will not run out until after school has started here in the state of Connecticut. I have heard from many teachers directly that are very unexcited, I'll put it that way, about being vaccinated themselves and having to teach class while wearing a mask. But I think that's something over the next few weeks that a decision will have to be made on. Again, I think it's important that we follow the data and we look at exactly how many people are in the state of Connecticut infected with the COVID vaccine, what the hospitalizations look like, and if we can encourage people to get vaccinated that are in the categories that have the ability to get vaccinated but yet are hesitant by providing the most transparent data, we may be looking at something very different in the next coming weeks.
Dr. Saud
Jen,
Anwar.
can I add a couple
Yeah,
of...
sure.
Yeah, so here's what we learned about the Delta variant. This is actually spread in India. That's where it had started, and now in Indonesia. In Indonesia, every week, they're losing 100 children. 100 children are dying every single week in the last many weeks in Indonesia. And if you look at the number of acute care beds in the state of Connecticut, of all the beds that are there about 3 to 4% of those beds are for children. So again, our data and the planning was based on how many beds are available to take care of individuals who are going to be very sick. So a death of one child is too many. So again, if we know also that while it's inconvenient for children to wear masks, but the children have done very well, much, much better than adults when they're wearing masks. So if we can save lives of our children by actually having them wear masks, we are going to come out better than what other parts of the country and other parts of the world are going through right now. So I think it's important to look at that aspect too.
Dr. Anwar, are you saying that this variant is, because the past version, or however you say it, of COVID was not potent with kids who are younger? So first of all, can you tell me, when you say child, are you talking about, however many newborn months all the way up to 17? Is there a specific age range that's more affected right now?
So we have seen,
and if this variant is more potent?
Well, we know that this variant spreads much more rapidly. That's one. And the amount of virus burden that individuals have is much more, and that's why it spreads so fast. And we also know that at least in children, what we are seeing is a much higher death rate in some of the countries. And I think that's because of the virulence of the virus, but also because the healthcare systems have been exhausted as well. So it's a combination of both of those issues that are leading to what we are seeing right now, at least in Indonesia, and then we have seen earlier in India.
Scary.
And I can just add that, obviously, and I agree with Dr. Anwar that any loss of a child is not acceptable. However, I do think it's important to keep in context that, we are comparing what's happened here in the United States versus really a third world health system in India and Pakistan with very, very large overcrowded populations. So it's not necessarily easy to correlate, apples to apples. So I think we do have to keep that in mind. And we also have a very high vaccination rate here in the state of Connecticut. I think one of the best things that we can do here in the state of Connecticut, instead of focusing on the negative, is to encourage people to get out and get vaccinated. You can get vaccinated almost anywhere in a CVS, at Stop and Shop now. So that is the most important thing we can do. It helps stop the mutations of the virus and these new variants. But again, people that are hesitant, which seems to be the issue, those folks need to feel comfortable. And the best way that we can make them feel comfortable is to be as transparent as we can with the information that we have here in the state of Connecticut.
Dr. Anwar, how far away do you think is the FDA from granting full approval for the vaccines?
I don't know, but with respect to the emergency use authorization, that is basically FDA saying that we are in the midst of a disaster and they're giving full permission to be able to use the vaccine. That's why most of us in our state, about 60+%, have been vaccinated. And we're showing that the ones who have been vaccinated are getting protected 94% of the times. So this is pretty clear. Now, the individuals who are hesitant, they were saying wait and see. And we have waited and seen, and we waited, and we have seen that it works and it's saving lives. And it's time, because of this Delta variant, that we can't wait anymore. And I completely agree with Senator Summers. Like, we all need to reach out to all individuals and then get them to vaccinate. That's the best way they can save their lives and their neighbors' life and the community's life, and make sure new variants don't show up, which are going to be more complex for us to manage. So we should be all united in our state, having the same message. Get vaccinated as soon as you can. Please protect your loved ones. Do it for your loved ones.
A bipartisan message this morning. Go ahead, Senator Summers.
Dr. Anwar brings up a really good point that we have given X amount of vaccines, millions of vaccines here in the state of Connecticut. But one thing that's lacking, though, is we need to have DPH come out with the correct information of how many vaccines we have given, what the results are, how many people have been truly protected, and is there adverse effects? If there are, what are they? What has been, the significant adverse effects? That's the information. When I talk to people who are hesitant, that's what they want to see. And that really has not been put out in a way that I think is accepted and meaningful for those who have hesitancy. I think if we can do that, along with a combination of FDA moving along to a full approval, because an EUA is very different than a full approval, that would help with the confidence of individuals that are hesitant on this particular vaccine, and really help us be able to promote those who haven't gotten a vaccine, especially who are younger, to go out and get it. I can tell you that I have spoken to somebody who's in their 20s who got COVID, who never thought that they were ever going to be susceptible to this disease. And they should be a spokesperson, because, they spent 5 days in the hospital and said, I am never going to, tell my friends to not get the vaccine. What I went through, I don't want anyone else to go through. So those are the kinds of people we need to have come forward and talk about their stories, so people do recognize that, especially with this variant, which is, so much more easily transmitted, that if you're younger, you can get sick. And I think that's an important message for people in the state of Connecticut to understand.
Dr. Anwar, you have the last word.
Well, I agree with Senator Summers. We need to get as many people vaccinated. Look, as the numbers increase, we will have to have people wear masks as well. This is to honor and protect and respect our individuals who are not vaccinated or who are vulnerable. So we have a responsibility to get vaccinated, wear the mask, and make sure that we are protecting each other. This is how a community is built. This is how a community survives a pandemic. And let's do this because we have no other option. Do it for our loved ones, do it for our neighbors, do it for our community. Protect yourself, get vaccinated, wear the mask. Thank you for doing this.
All right, Senator Anwar and Senator Summers, thank you both for coming on The Real Story again. Appreciate it.
Thank you. Have a great day.
Me too. All right, ahead on The Real Story, Connecticut has one of the worst unemployment rates in the country. But our next guest says there's more to the story than just that number. Columnist Red Janke says that we are in a full-blown jobs crisis that he believes has dire consequences. He's going to walk us through his thinking right after the break.